this time. Are you able to do the thumbs up for me, just so we know that we know how to use that? We all know how to use it, but oral cancer is something that affects a lot of people, young or old. The way that the oral cancer is changing, it used to be the old smoker that smoked for years and years, but now it's more, hang on, I'm going to lose it here for a second. It's changing more to the younger person, and I'll explain that in a little bit. So we're going to get started. We're going to start with a poll. So we're going to start with this poll, so you can go ahead and vote. Do you know anybody who has currently or has had oral cancer? Okay. Okay, we have 2 out of 3. Can you see it, Cheryl? Hi, Connie. Can you see the 3? That's 3 votes. Oh, good. Thanks, Cheryl. Okay, Connie, thank you very much. I appreciate you being my tech person, and yes, if you can record, I did start recording. So I'm going to go ahead and stop voting. So 2 of you have both said yes and no. So I'm going to ask you to go down here to the chat box, and if you'll please just put in there if you know where the location of that cancer was. With that person. Another question that you can't hear, Connie? Can everybody else hear me? I think everybody else is hearing me. Sorry. Okay. I'm going to ask if everybody can hear me to go ahead and give me a thumbs up, because I don't think Connie can hear me. Okay, well, I'm going to go on, Connie. I'm sorry. Okay, thanks, Ingrid. And you thought it was somebody that had cancer, Ingrid? Do you know what type we're at in their mouth that they had the cancer? Okay, so we're going to talk about the causes. That's okay, Ingrid. We're going to talk about some causes and contributing factors to oral cancer. Two of the most important factors of cancer in the mouth is the use of tobacco and alcohol. And smoking is the single most important risk factor for oral cancer. What happens is the heat from the cigarettes, the cigars, what it does is it damages the membranes of the inside of the cheek. And with alcohol has a drying, it dries out the mucosa, and so what happens is that it causes your tissues in the inside of your mouth to become more permeable, and it changes how your tissues reproduce. And also smokeless tobacco. Currently I have about 4 or 5 young boys. They're between the ages of about 12 to 16, and they've already been using smokeless tobacco for about 2 years. So I always give them their oral cancer screening. Thank you, Ingrid. Okay, I'm going to move on. Some other stuff is a lot of sunlight. We live out here in the Southwest, most of us do, and we have a lot of exposure to the sun, and we need to be sure that we're wearing sunscreen. Another factor is poor oral hygiene. People who have a lot of smoking causes it, and it is related to periodontal disease or gum disease. And also, I'm going to slow down, sorry. Poor oral hygiene, whether you're flossing or you're not flossing or you're brushing, or I see people every day that don't brush their teeth. And also nutritional deficiencies, such as a diet low in vitamins and fruits and vegetables. Excuse me, I start getting so nervous. When I was telling you earlier about the change of the type of patient that we're seeing that has oral cancer, is this specific reason. HPV is human papillomavirus, and the strains are 16 and 18, and that is the same HPV virus that causes cervical and uterine cancer. And so they're finding this link, excuse me, they're finding this link inside of the throats because they're having oral sex, and so that's why the younger generation is getting cancer, the HPV specific cancer in the throat and down in the tonsils. That's why when you get your oral cancer screening from your hygienist, you need to make sure you're looking at the back of the throat. And also congenital and acquired defects of the immune system. You know, we can be born with immune system that is compromised, and acquired defects can be a lot of like HIV or AIDS that gives you that extra risk of being at high risk for cancer. Does anybody have any questions? Okay, I'm gonna go. I'm sorry, I'm going slow. Here's some pictures. Sometimes people see things on their tongue or in their throat, and they're not really sure of what's going on, but these are actual squamous cell carcinomas, and most of these patients are in the age range of like 40. I think one of them is a male that is older, but if you ever go on to like YouTube and you watch a lot of videos, or if you've seen it on the TV, half off. Okay, and so I'm going to go next. I'm going to start talking about signs and symptoms. Most oral cancer goes unnoticed in the early stages. Most often it can be painless, or it has very little physical change. It might be a small lesion, usually on the floor of the mouth or on the side of the tongue. We call the white ones leukoplakia, and we call the red ones erythroplakias, and they're patches of tissue in the mouth that don't look just quite right. And also according to the statistics, the red lesions have a higher risk of becoming cancer. Does anybody have any questions? Everybody can hear me? Here are some signs and symptoms. Thank you, Ingrid. Small indurated ulcer. Sometimes they can be hard. That's indurated, like a canker sore. At the end of the presentation, I do have a link for you that you can go and watch a rap video about a woman who didn't smoke and didn't drink, but she had a canker sore that never went away, and she is a survivor. There can be hoarseness in your voice for a long time. There's numbness of the oral facial region, and you know, you can, when I show you the next step about how to perform an oral exam, you can also palpate around your ear and down in the side of your neck. It's really important. Also across your cheeks, underneath your eye, and also the persistent earache. I know that Eva Grizel also said that hers was an earache. Everybody doing okay? Okay, so I'm gonna talk about detection, intraoral and extraoral exams, and for this I'm going to show you a little video. So I'm going to close this, go to my YouTube, and I'm going to play the video, and you can
Oral cancer prevention.
might be too loud.
Intraoral self-exam. Begin the examination in front of the mirror with lots of light and properly washed hands. In the intraoral examination, we look for signs of atypical development of oral tissues, such as nodules, ulcers, atypical growth, and red, white, or black discoloration of the tissues. The search for discolorations, ulcers, and overgrowth is done through visual inspections of the regions of the mouth, as shown. The search for nodules is done through the palpation of lips, cheeks, and floor of the mouth. Here, we observe the meticulous palpation of lips and cheeks being executed after the visual inspection. Following that, proceed with the visual inspection of the gums, from the lower arch and the upper arch. Then, the visual inspection of the tongue, including both sides and the floor of the mouth, followed by palpation of the tongue and the floor of the mouth, as demonstrated. To finalize, we do a visual inspection of the palate and the back wall of the mouth, including the palatine tonsils and the uvula. As in the extraoral examination, finding atypical development of tissues do not necessarily.
Here's a link. I'm hoping this opens because I did have trouble with this opening, but if you can't see it, I'm going to go ahead and do my screen share. And it's a little activity. This is where I have to go slow and keep patient. So I'm not sure if it opens, so let me know if you can open that. It is on Google Drawings, and I think you can see it here. And if you can edit, that's great, and if you can't, I'll show you how. If you go to Insert and you click on the arrow, and that gives you a line. But what I want you to do here is show me where you think would be the site for the most common type of oral cancer. And I'll give you a minute to do that. So, okay, good job, Cheryl. So if you can't go into this, then you can just answer that question, and I'll go back into this and turn it off. Yeah, I had trouble with that. Sorry, Adrian. Thank you so much for your help. But I'm going to just go ahead and continue on because I'm not sure. So the intraoral and the extraoral exam, and it didn't really show you too much about the extraoral, but what you're going to do is, palpate behind your ear and the back of your neck and along your hairline, and you're looking for anything that's swollen or any kind of lumps, okay? The next part of radiographs is, the next part of detection would be radiographs or x-rays. They do show a lot